Yeah.
So hello to everyone. Welcome to the first MedEd talk of the year. I'm Ben and Joanna. We're the co-chairs this year. So, yeah.
And
yeah.
hi guys. Oh, sorry, Ben. My bad.
No, you go.
I'm Jaya. Me and Vasiliki are the Year 5 MedEd coordinators for this year.
Hi guys, from me as well. So for this session on How to Year 5, we want to introduce Laz and Dan, who are going to be our speakers for today. Thank you guys so much for agreeing to talk to us about how to survive Year 5. As Dan mentioned, if you have any questions, leave them in the chat, and Laz and Dan will try to answer them as we're going, or in the Q&A session at the end. Without further ado, I think we can begin.
Right, shall we get going?
Yeah.
Okay, so Dan's controlling the slides, so I'm going to have to just tell him to move on. Yeah, so first of all, guys, congratulations on finishing 4th year. I'm sorry it was a bit of a weird sort of last 4 months, but at least you've got a fairly normal 5th year ahead of you in terms of firms and exams and everything. So we're going to try and be fairly practical about this advice, because you hear a lot of stuff from old years about how 5th year is really difficult and about how there's loads to learn. And essentially there's a lot of negative connotations associated with 5th year. And understandably, a lot of people are quite scared when you get started. So we're going to try and break it down step by step. And these are the things that we'll be talking about. So I'll be talking about sort of the first few things, so path and specialties, exam and resources. And Dan will be basically covering all the rest about firms. So Dan, could you move on one slide? Oh yeah, so first of all, with 5th year, people get intimidated by it because they know that it counts. And I thought I'd just spend a minute explaining exactly what that means in terms of how it contributes towards FPAS. So to those of you who don't know, FPAS is the nationalized system that's used to essentially allocate your first jobs, so as F1 and F2. And it's scored out of 100. 50 points are for the SJT, which you can worry about next year, and 50 points come from med school. So if you just move down one more click. So within that med school 50 points, 34 of them are allocated to everyone. So you don't really have to do anything as long as you get through, you've got 34 points. And then from 34 points onwards, you get 1 point for every decile you're in above the 10th decile. So for example, the top decile will have 43 points in total. Then on top of that, you have your BSc. So if you've got a first, it's 4 points, 2, 1, 3 points, and so on. And finally, the remaining 2 points are available for publications which have a PubMed ID. So I'm going to talk a little bit later about stuff you can do to fill in some gaps in 5th year, because you will have some periods where you have placements that don't matter a huge amount, and you can do extra things like doing lattice editor and projects and things. So just move on one more. So with regards to the decile, that's the bit that 5th year contributes to. So your decile is based 40% on your 3rd year result and 50% on your 6th year result. And within the 60% for year 5, it's broken down as follows at the bottom right. So as far as I'm aware, it should be the same for you guys, because you will be doing the same exams as us. This would have changed for the year below me because they didn't do paces. But essentially, maybe double check this, but I'm fairly sure it should be the same. So just move on to the next slide. So I'm going to start off by talking about PATH. So PATH has a lot of lectures. So you've got 4 weeks of lectures, which I'm sure you're in the middle of right now. And you've got the week 0 lectures as well, which sort of adds to the workload. But it can be managed. And it's actually a really good course, because once you start working as well, you realize how much PATH knowledge infiltrates into your job and how useful it is to actually understand what's going on a pathological level. So pathology is broken down into 5 big subtopics, and it's very much like MCD in 1st and 2nd year, in the sense that you have the course leads, who I'd say the majority of the questions in the exam come from them. So if you move on one more, there's a few points I wanted to make about it. So first of all, it's not really any different in terms of how to go about it than 1st and 2nd year. So you just do need to make a list of the lectures, make notes on the lectures if that's something you like, use someone else's notes if that saves you time. And it's literally just a matter of learning as you did in 1st and 2nd year. And you guys are very well versed in that. So that shouldn't be too much of a problem. It's just, it can be a bit difficult in the sense that you do it very early on in 5th year, and then you sort of forget about it for a long time, and then you revisit it. And it can sometimes feel like it's a lot to learn on top of specialties. but I've put a few tips here on how you can go about it. So like I mentioned, the lecture lead lectures are by far the most important ones. So in terms of focusing your revision, this is a tip for much later down the line, but if you feel like you're tight for time, I'd focus on the lectures that are by the lecture leads, because that will cover, I'd say, a good 70% or so of the exam. It is also fairly sort of discrete knowledge based, much like first and second year. So repetition is very, very useful. So there's a few Brainscape decks that people in the year below you have used. I made one on Path, and so did Ramesh Teramana. So you should just subscribe to both of them. And I did Brainscape cards basically throughout the entire year, and well, much more so towards the second half of it. But it's quite useful because there's so many specific details within Path, which will only stay in your short-term memory for a relatively short amount of time. So having that repetition ticking over and over is quite good to consolidate that information. And the final tip is also pretty important. Right now, you guys are probably fairly motivated to get on with fifth year because you're excited to do something new. But there isn't a huge amount of time, a huge amount of benefit in learning it too early. So it's worth getting your notes in order and knowing how you're going to revise it later on. But I'd say it's important to use this time essentially to prep yourself such that you can hit the ground running when it comes to, I don't know, February time next year. So there isn't much point you just sitting down and trying to learn the whole sort of hemoglobin breakdown pathways and stuff like that, because that's not going to stay in your head for very long. And it is just a bit of a waste of time. So try and understand concepts, but don't worry too much about the very specific details of it. And regarding resources, there's old years notes. PathBase is something that you should probably have a look at further down the line. It's essentially just a bunch of questions that I think some Imperial grads put together. It's pretty useful. And I think in our year, it was free for a reasonable amount of time. But then I think close to exams, they made it like £20 subscription or something. So I'm not entirely sure whether you have to pay for it right now, but it was quite good. It explains stuff very well. There's also a book, 450 SPAs in Clinical Pathology, which was written by some Imperial grads. I'd say I'd only do this book if, like, once you've revised Path and you know it relatively well, which is the opposite of the advice I'd give for most SPA books. And the reason for that is because this book does contain quite a lot of mistakes. So you want to make sure your knowledge is decent enough for you to be able to identify the mistakes in the SPA book and not just take everything it says as being true. But it's still worthwhile in terms of practicing questions. Brainscape flashcards I've already mentioned, and also past papers are worth looking into to get an idea of the types of questions that they ask. Is knowing Path a necessity for placements? No. So I don't exactly know what you mean by that question. It's not essential for the placements themselves, because realistically, the amount you engage with placements varies, and I don't feel that pathology is something that they're going to test you on whilst you're on the placements. But in terms of the sort of long run, your understanding of pathology does benefit you massively in future years and in your career as well. So it's something you shouldn't just cast aside as being meaningless MCD type stuff. It's actually very, very relevant. Right. Any other questions on Path? Just give me a moment. Who's the second person? Ramesh Teramana. Let me just type that here. So if you search him, there should be a deck of cards, like 1,000 or so cards on there as well. I'll give 30 seconds more for any other questions on Path. I'll move on. Who else? Is it just myself? So. Okay, so hold on, just one at a time. So when's best to start revising? I'd say with Path, people tend to start revising it more intensely in around February or maybe March, just because anything earlier is probably not going to be that beneficial. So I remember over Christmas, I used that time to essentially catch up on any lectures that I hadn't made notes on. And then I sort of left that aside for a bit as well. And then I started again in around February, just to give you enough time to cover everything. Do we need to review Path mid-year, or is it calm to leave it 40 weeks? I'd say it's honestly not a big issue to leave it for a while, just because most of it, as you will see from the lectures you've attended, most of it is quite specific knowledge. It's the type of thing that you do sort of need to learn fairly intensely close to the exam. If you want to, you can just sort of review the topics over Christmas or something, just to keep it fresh, like somewhat fresh in your mind. But I wouldn't say there's that much harm in not really focusing too much on that during the bulk of your 5th year. And do they actually count the 5% for attending lectures? I can't answer that. So we thought it did for us, but we never got any email saying, okay, you've been to 3.5 out of 5% or anything like that. So we don't really know what happened with that. We're not sure if that was just a sort of scaremongering tactic or not. But I mean, I didn't really go to that many lectures myself, and my percentage wasn't like, I didn't feel like it was decreased that much. Is there a lot of overlap with path and specialties? No. So, well, there's some bits. So for example, with like ovarian tumors, knowing the different histological subtypes, there can be a little bit of overlap in that case, but I'd recommend just treating path and specialties as two completely independent things. And a few people have asked me this question before, but you should just treat them as two separate bits. That there are overlapping, like relevant lectures. So for example, there's one on gynecology and a few other things, but realistically, they're not intertwined. So you should just treat them as two separate aspects of 5th year. Right, I'm gonna move on now. So
I think over to me for the next stuff, Laz. And
okay, sure, go ahead.
Yeah. So hi everyone, I'm Dan, and I'm going to be speaking to you a bit about firms in particular and some of the support that you get from MedEd during 5th year as well. Just to kind of chip in with my own thoughts on some of the questions. I definitely agree, you do not need to be revising path right now. Most people start their path revision earliest probably January. A lot of people often March and April. The path lectures by MedEd are normally January to March, and that's often when most people start off their path revision. Personally speaking, I tried to do 2 modules during Christmas, and by the time it got to exams, those were the 2 modules that I'd forgotten most of. So yeah, there is a bit of a danger if you do it too early that actually you've just wasted a lot of valuable time. The question is knowledge from years 1 to 3 required for the path exam. Path, I mean, no one would call path nice, but when you compare it to the other exams you do this year, it is quite nice that everything that turns up in the path exam is from the path series. So not going to throw in some random bit from a year 2 lecture. Everything that you get in your path exam will have been taught to you in the path lectures. That's one of the nice things compared to kind of specialties where there isn't like a finite amount of knowledge you need to know. There are a few areas of overlap when it comes to firms, but I'll highlight what those are when we get to them. But obviously I know for a lot of you, you've just finished BSc year, most of you, and going back to placement, especially during a pandemic, is a little strange. And if you try and think back to kind of how things were in year 3, I quite like this here, that when you start year 3, you get quite excited that you're going to be in all these different clinics and operating theaters and things, and it's going to be really exciting. And a lot of the time, you kind of find that people don't have time for you. Part of me does worry that because of the pandemic, that might be similar this year. But I'd probably say from my own experience and from others, as you get through year 5 and year 6, and you kind of get a little bit more authority, you do find that doctors respect you a bit more. And especially during year 5 and 6, I felt that on the whole, doctors were very keen to kind of do what they could to help you out when you're on firms. So year 3 was often just a case of kind of show up and learn what you need to learn. What's the difference then with year 5? As you probably heard before, the key difference this time is it's about management. So being able to figure out what's wrong with a patient was quite very much year 3. Being able to examine them was very much year 3. Year 5 is getting you to go that final step of, okay, what do you think is going on and what are you going to do about it, basically. And some key things that they often want you to know about, not just for PACEs, but for your exams as well. When should someone be admitted to hospital? So not just kind of what is their treatment, but where should they be treated? That's also key to know. And as a doctor, that's how you need to imagine this. Imagine you were a foundation year 1 doctor. What teams would you need to involve when you were treating this patient? So who might you need to make a referral to? Who exactly would you need to contact to get the treatment that this patient needs? And so compared to year 3, there's very little focus on practical skills during the year. It's much more about improving your history taking and especially your communication skills. How do you explain things to patients? And how do you break bad news, for example? if all of that sounds a little bit scary, the key thing, kind of a good way to remember anything is, would this make me a safe F1? So knowing when to admit people to hospital is obviously quite important. And therefore that's a common question in PACEs of, okay, this patient's come in with X problem. Do you think they need to go into hospital or not? So throughout 5th year, the general kind of thing they're wanting you to develop is safety, clinical safety. You know when someone needs to go to hospital. You know when kind of things need to be escalated a bit. So let's talk a bit about PACEs. I'll give you an idea kind of how PACEs works in general. In terms of the chat, I would just suggest leave path until the end now, otherwise you'll keep getting distracted back and forth. So if you've got any questions about stuff already covered, we'll come back to it at the end, don't worry. So PACEs. PACEs is a bit like OSCE. Obviously you have stations. The stations are a bit longer though. And we did the same type of PACEs that you did, 8 stations. There used to be 6 in the past. And this is how they're broken down. 2 on psych, 2 on peds, 2 on obs and gynae, and then 2 on general practice. What we mean by general practice, it can be any of those 3 specialties, but in a primary care setting. So it could be 1 pediatrics and 1 psychiatry, but you'd be at the GP, and the kind of conditions that would turn up would be the type of conditions that are managed at a GP. So for example, if you were to get a schizophrenia history, that would generally turn up in psychiatry because GPs don't manage schizophrenia. But if it was depression, then it is quite likely it could turn up in GP because GPs do manage depression. So normally you'll find psych, peds and ONG are in a secondary care setting, either the hospital or A&E, whereas GP can be either of those 3 topics, but in a primary care setting. So how does it work? We said you've got 8 stations and each one is 15 minutes long. Like the OSCE, you'll get a brief. I'll show you an example one in a second. And you've got 2 minutes to read through. A little bit longer than OSCE. I think the reason for this, the briefs are a bit more substantial. There are more things you need to do in the 15 minutes. And you get a bit of thinking time to kind of think, okay, I'm going to take a history on this particular topic. I need to do this, 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 and this. Theoretically, DOPS can feature. So if you've got your iPad in front of you, you probably now have the DOPS loaded onto it for this year. The main DOPS that might turn up in PACEs are those from obs and gynae. So you might have to examine a pregnant abdomen. You might have to do a vaginal exam, all on a model, obviously not on a real patient. But yes, I know from my own PACEs that one of the stations was to do a vaginal exam on a model. But on the whole, most of it is history taking and talking to the examiner. When they write PACEs, they actually get together a psychiatrist, pediatrician, obstetrician, etc., and they all write the stations on one day, and they write them as a group. And I remember a talk from one of those who writes the psych stations, and she was explaining if she's going to turn up for the day to write her psych stations, she's not just going to write them and then stay silent for the rest of the day. Instead, she's going to kind of chime in and help out with the other stations. So you commonly find that there's a lot of crossover between different stations. So what I mean by that, take, for example, you might have a pediatric station and it is chickenpox. Mother's come in because she's concerned her child has a rash and it's chickenpox. Pretty simple, but a big danger with chickenpox is if it infects someone who's pregnant, it can lead to complications for the fetus. So almost always, if you look at previous years for PACEs, if someone comes in with chickenpox, the mother is normally pregnant. Why is that? Because they've had both an obstetrician and a pediatrician write the station together. So do think about that. Although you might have a ped station, there might be elements of the others in the ped station. So although you've got separate categories, they do overlap quite a lot. And there are lots of example stations out there. I'll show you one in a second, and I'll talk about where to find more. For firms, one tip I give you, have a read over some of the stations before you start firms. because it'll show you what kind of conditions and what sort of topics turn up quite regularly. And then when you're on firms, you'll know the sort of stuff that you should be looking out for. So here's an example station. This is the kind of brief you get on the door. It's quite similar, I think, to one I'd had in my exam. You're the F1 in A&E. So again, they'll tell you, where is this? Primary care, secondary care. Tom was brought into A&E by ambulance after his friends phoned 999 following a collapse. Please take a history from Tom, and they'll tell you how long you have. Counsel Tom, and then answer questions from the examiner. So they'll tell you roughly how to spend those 15 minutes. Most of the time, they will actually not kind of stop you unless you start kind of going massively over time. So if you hit 8 minutes and what you're saying is still worthwhile, they'll let you go to 8 minutes. But if you've got to 7 minutes and you're just asking kind of silly questions because you think you need to keep going, they'll say, thank you for that. Okay, we'll move you on now. But what you find in a typical station, there always is a history. There has to be a history in each station. At the end, they often might give you a bit of data. They might give you some test results. They might even ask, okay, what test results do you want? And then they'll hand them to you. You need to interpret them there and then on the spot. And then you need to explain them to the patient. And typically you get about 4 minutes of Viva time where the examiner is going to ask you questions. And I think for a lot of people, that is the scariest part of PACES. So we'll chat about that a bit as well. So what actually turns up in the Viva? Here are a few example questions. It's a little bit like the last 2 questions that you might get asked in your OSCE, but this time it's worth a lot more. The Viva is worth at least 25% of your mark. And I think going into 5th year, it's often where people are weakest. You get quite used to kind of your patient manner, how to talk to patients, but actually talking to an examiner, it's a very different communication style. What they want to see is that you're structured, you're concise, you're not just kind of trying to remember things on the spot. So if they ask for differentials, for example, you don't just want to kind of blurt out random things. They're looking in for a structure. So say I had a station on epilepsy or collapse. And so if they asked, what are your top differentials for this patient's cause of collapse? If you just blurt out, oh, valve disease, epilepsy, it looks okay, but it's not amazing. What you want to be doing over the year is trying to package things into your head quite nicely. So if they ask, what are your top differentials? You can say, okay, my differentials would include firstly a cardiac cause, such as an arrhythmia, neurological causes such as epilepsy, or a metabolic cause such as hypoglycemia. And if you can package things and structure them like that, often it makes you sound a bit more slick. So over the course of the year, try and work on your Viva skills. Best way to do it, again, is to practice in groups and grill one another a bit. Now, the problems with PACES then, communication is more difficult compared to 3rd year. 3rd year, it was, okay, take a history, and occasionally they might say, oh, I'm nervous, I'm anxious, and you might need to console them a little bit. Here, there will almost always be a little bit of difficult communication. And it's firstly either the patients themselves are difficult. So if it's psych, they might have someone who is flirting with you, who's making inappropriate comments, and maybe they have kind of mania or they're psychotic. And you have to set boundaries with the patient and say, I'm sorry, if you keep making comments like that, we'll have to terminate the consultation. Maybe with not that such a scientific phrase, but other examples, you might need to tell someone kind of what do their test results show? Perhaps it shows that they're infertile. And almost always you'll need to be explaining things to patients. So someone's been diagnosed with diabetes, what actually is diabetes? How will it impact their life? And answer any questions that they have. You also need to know a little bit about law. So you often get some kind of ethics and law e-modules across the year. And as always, they're pretty boring. But they do turn up in the writtens and they do turn up in PACES as well. So for psych, it's the Mental Health Act. For obs and gynae, it is about generally abortion. And for peds, the Fraser guidelines. So remember Gillick competence. You might have a child who's 14, who's wanting contraception. And that in one way is a bit of peds, but it's obviously a bit of gynecology as well, because it's contraception. So do know your law quite well, because not only will it turn up in writtens, you'll get directly asked about it, but you might have a psych station, and at the end, you might say, I think this patient needs to be sectioned, and they'll start quizzing you on the different parts of the law when it comes to sectioning patients. So that's one key area you need to know a bit about. And like I said with the Viva, being concise, having a structure, practice makes perfect, basically. You can find the PACES mark scheme either on Blackboard or MedLearn. I can't tell you where it is exactly. Here you can see the exact mark scheme. You can print it off. You can use it for one another. And it does highlight, most of it will be about history, formulation of clinical issues. So that is looking at, okay, can you put together a working diagnosis? Can you figure out what is likely to be the cause and what is less likely? Management, we said, is a key part. And then 25% of the marks are for professionalism and communication. But as you can see, half of it is how you communicate to the patient, half of it is how you communicate to the examiner, and that's where the Viva comes in. And it also picks up on things we mentioned earlier, considers legal and ethical aspects. Good question besides, in the PED station, are you ever taking a history from a child? This is an interesting one. So most often, especially if it's a 4 or 5-year-old, it will always be a parent. But if they're a teenager, it can be an actor playing a teenager. Like your histories in 3rd year, all of the stations are professional actors. They don't always do the best job of finding the right actor. So I remember for that example I just gave you earlier of the child who had an episode of syncope, basically, I walked in expecting to see a 14-year-old, and there was a 30-year-old actor there with a full beard. So it is a bit ridiculous. But yeah, they can either give you the parents of the child, or if they're a teenager, it'll be an actor playing a teenager, probably not that well, but giving it a go. Does that answer your question? Let me know at the side if it does. Where do you find PACES cases? The best way to revise for PACES is to actually come up with your own. Formulating a history yourself and some differentials and some Viva questions is an actual really useful way to revise. But you will find lots out there already. So we mentioned past papers. I do believe there is a Facebook group somewhere for past papers. And it will have not only the writtens, but PACES cases. You often come across lots of folders that people have kind of shared online. You might be able to see those, chat to your friends. Also, you can use patients you've seen on firms as a bit of inspiration. So if you see a good case, come home, write it up. And you do want to form PACES groups. Normally after Christmas time, earliest January, maybe February, March, people start getting to groups of about maybe 4 or 5. And they go through cases with one another so that you can practice the Viva and you can practice doing these difficult kind of communication stations. So that's PACES. Any questions on PACES, do let me know. One question here, how do you think our PACES preparation tutorials might be affected by the year above us not having their exam? So I don't think the PACES stations themselves will be any different. I think you are at a slight disadvantage because obviously when I last did PACES, we could get advice from the year above us. You can do that for specialties this year and you can do it for PATH, but the year above you did not do PACES. But they do need to do PACES. They do need to do PACES in final year. They need to do a similar PACES to you. It's a bit shorter. So in one way, it's annoying because they can't offer you the sort of advice or practice that my year might have received, but they'll be revising for it too. So actually, you might be able to get into groups alongside them as well. So I would say that's the main thing there. That history was on collapse. Do we need to revise 3rd year again? The only part I'd say that overlaps heavily with 3rd year is PEDS. Because in one way, PEDS is just general medicine, but in a child. So you do need to know about epilepsy, most commonly diagnosed in children. You need to know, obviously, about arrhythmias. Children can have an arrhythmia. So I would say you don't need to go away and properly revise 3rd year like you did in 3rd year. But you will find that for a lot of PEDS, some of the conditions you have studied in third year before, but I wouldn't say you need to kind of formally revise third year. You don't need to go back to third year lectures and things, definitely not. Although PEDS looks at most of medicine, there are certain conditions that are a lot more common in children than are common in adults. So there is a bit of overlap, but it's not exactly the same thing. Now, firms. Overall, I would say there are kind of three main categories for firms. I've got one other question here as well. Since there's so much overlap, are stations labelled outside PEDS, ONG, Psych? Yeah, so when you read the brief, you will quite clearly know what station it is. It will become quite clear, so it might say, okay, that you are the FY1 in psychiatry. You are in A&E seeing a child. So although there is a bit of overlap, most of it will still be on the specialty that it says it is on. Just be aware that there can sometimes be a bit of both. So for example, it might be that you've got someone coming in for a newborn baby check, but the mother herself has postnatal depression. So there can be a bit of overlap, but when you read the station, it should be clear what the station wants. So any of the PACES questions I'll come back to at the end. Let's chat a bit about firms now. With firms, as I said, there are kind of three overall types of firm this year. The most important one, what people call the big three, are the specialties that are relevant to your exams. 7 weeks in PEDS, 7 weeks in ONG and Psych. Challenge with fifth year is you're all doing them at different times. I'll chat about that at the end. All of the other firms, some will have relevance to fifth year, to either specialties or path, like we said a bit earlier. I'll highlight what those are. But the vast majority of these are actually 6 year firms. So why do you do them now? There is not enough time in 6th year for you to do oncology or radiology, etc. So in order to make things work a bit better, they squeeze it into 5th year. That's what makes 5th year so long. So what it tells you, obviously, for exams, the three at the top, they're your priority. For the others, definitely look at where there's overlap. We'll talk about that. You do not need to understand the other firms inside and out. And the argument is, oh, if you learn it now, it will help you in final year. My derm placement was over 15 months before finals for 6th year. Could I remember any derm from that placement? No. So some people do find it useful to help you out a bit later in final year, but yes, there's going to be quite a big time skip between finals in year 6 and a lot of these placements here. And then one of the nice things about 5th year, you get some study leave as well. You basically get 4 breaks on top of Christmas and on top of Easter, which is really nice. I'll talk about how to make the most of your study leave at the end. So we'll just chat about the core 3 now and just some things to keep in mind. Obstetrics, I'd say most people find this the most tiring firm. Often you do need to be on the hospital, you need to actually turn up. And there are 2 main places you'll be, either on the labour ward or at clinics. I loved obstetrics. I thought it was really good placement because all the doctors generally are quite nice people. Some tips, do make friends with the midwives, especially on the labour ward. So on your DOPS, you'll hear rumours of, oh, you need to observe 10 births. That was what Imperial did many, many years ago, no longer true. But they do want you to see a variety of births. So a birth through cesarean, a birth with forceps, with a ventouse. And so if you chat to the midwives and you say, oh, I've seen this kind of birth, but I really need to see a cesarean, they can say, oh, this patient here is likely to be getting a cesarean, or we're likely to induce them later. And they're really, really useful because actually they know the patient's best, and they can often take you into the room with the patient, introduce you, and then hopefully you get to observe the birth. Most placements, you probably heard West Mid is infamous for this as well. Do night shifts on the labour ward. I did 1 night shift, and it was probably one of the most helpful days I did in 5th year. Got to deliver a baby, was pretty fun. Night shifts are useful because the doctors have a bit more time, hopefully, fingers crossed, to take you through things. As I said earlier, you do need a structure for your Viva. So the structure in obstetrics, they might ask, okay, what are the complications of diabetes in pregnancy? And the way to structure your answer is to consider the antenatal complications, what happens during birth, or before birth, perinatal around the time of the birth, and postnatal after the birth. And that's a nice way to structure answers in your head. So when you see obstetrics, like I said, use some example cases to show you what to look for. Certain topics are more common than others, like diabetes in pregnancy, or prolonged rupture of membranes. That probably sounds like gibberish. Basically, if someone's water's broke and they haven't gone into labor yet. So definitely some topics turn up a lot more than others. Gynecology is a bit more technical because there's more kind of management options in gynecology. What I'd recommend for gynae, clinics, super helpful. Because clinics mirror what you're going to get in PACEs. You're going to do some history taking. And it's probably one of your best chances to do examinations. You do, well, when I was in 5th year, you had to do a bimanual and a speculum, the 2 types of vaginal exam. I imagine it's still the case for yourselves. Especially for men, a lot of women will not be okay with this. So often the best place to get this signed off is to go to the gynae operating theatres. Explain to one of the patients on the ward that before operation, again, be careful how you phrase it. They'll often tell you to say student doctor rather than medical student, just because it has a lot of connotations, let's say. But if you're saying, oh, hi there, I'm Daniel, I'm a student doctor. As part of my learning today, I'm required to do a vaginal examination. I know you're having a procedure a bit later. I wanted to ask that before the operation started, after you've gone to sleep, would it be okay if I conducted an examination under supervision from the consultant? So you want to say something confident, something that sounds professional, and you only need to do 1 of each. Obviously, it can turn up in PACEs though, so good if you can do more. But I think especially for men, theatres is your best bet, but you can also try clinics as well. One common part of PACEs and writtens is to know 2-week waits. So to know what kind of presenting complaints require a cancer referral pathway. And you can go to these gynae clinics. You can go to the gynae cancer clinics, use these to understand what is an indication for a 2-week wait. They also have specialist clinics like infertility, and these things can actually turn up in PACEs. So one of my PACEs stations was a couple who are struggling to conceive, and you had to take a history from the woman, and having been to a fertility clinic, suddenly it was a lot clearer what you need to do. I'm guessing you probably wouldn't do a vaginal exam and do what the guy in the photo is doing here. It's a pretty terrible photo of basically looking at probably her vagina, I don't know, and then giving a thumbs up. I have no clue where I got that photo from. Anyway, peds is probably the biggest of the 3, because like we said, it is kind of general medicine in a small person. So you cannot learn everything on firms. Do not go into firms thinking you must finish your 7 weeks having done all of peds. I probably did 20% of peds during that time. There are some very core things that you should definitely wrap your head around, such as developmental milestones. When typically do children learn to walk, talk, etc.? When do children have different vaccines in the UK, at what ages and what vaccines? I think this also overlaps with PATH. And what are normal observations in a child, heart rate, breathing rate, etc. But like I said, you can't know all of it. You'll find that most of your peds knowledge will come from studying rather than firms, but still use firms to at least get some of that knowledge. I think the most useful part of peds for me personally, and for a lot of others, was peds A&E. Because peds A&E is super similar to PACEs. Family come in with their child, you take a history, you explain what you think's going on, and then you do the next steps. It's almost identical to some of the peds stations you'll get in PACEs. So of all the things for peds, that's what I emphasize most. We got a bit of a curveball our year, where one of the stations wasn't take history. It was actually, here is a model of a child. The child is having breathing difficulties. Do an A to E assessment on this child. And some of you might have heard the story of what I did on this one. I think it's quite infamous by now, but this was my first ever station in PACES, saw the sign, and I thought, this is not what you're meant to get in PACES. This is not a history. Walked in, and I thought, okay, it's going to be an asthma attack. It wasn't. It was anaphylaxis. And suddenly you've got this weird child dummy that you have to start kind of fake acting out this A to E approach. And if you think about anaphylaxis, the main thing to give is an EpiPen. I have never seen an EpiPen until this day of my exam. I've never handled an EpiPen. And so in my head, I'm thinking, where do I put the EpiPen? And I thought, you probably put it in the leg. I think you put it there. It's an IM injection. But on, which movie is it now? Someone help me in the chat. Which movie is it with the EpiPen in the heart? Yeah, it's Pulp Fiction. How could I forget? So on Pulp Fiction, all I could think about in my exam is, in Pulp Fiction, they put the EpiPen through the heart. So which one is it? And in a moment of panic, I decided to put the EpiPen through their heart. I do believe that the examiner didn't see this happen, because I still passed the station, even though 2 minutes in, I technically killed a child. So what I'm trying to say with that, although you're typically going to do history and explanation and viva, they can give you things like this. So a good thing if you're going to be in A&E, watch doctors actually do an A to E assessment. I had not seen any doctor do one, so I was pretty stuck on the day. Don't end up putting an EpiPen through someone's heart like I did. When it comes to management for peds, the multidisciplinary team is the key buzzword. They'll often give you a chronic condition like diabetes, and you'll have to talk through all of the different members of the MDT and how they support the patient, like a dietitian, the GP, the pediatrician, a psychologist perhaps, their school. You need to talk through how to manage a complicated chronic condition. Psych is notoriously relaxed. I'll just put it that way. I think you all know what we mean. A lot of people find psych quite easygoing. I think the main thing with psych, there isn't that much in terms of management. The two most high yield topics, firstly, pharmacology. So what medications can you give for different psychiatric conditions, and what are their side effects? What are their complications? That turns up very frequently. And then also in psych, there are lots of different teams that you will get placed with. For example, a crisis team or liaison psychiatry. And what you need to do on firms is figure out what the role of each of these teams are. Because when it comes to psych PACES, the first question will be, how will you manage the patient? But often the second question will be, which team do you think should manage the patient? Should it be a crisis team? Should it be the GP? So make sure on your psych placement, you get an idea of what types of patient are handled by which types of psychiatry team. There's quite a few different ones. History taking is super, super long. In reality, a psych history is normally over half an hour. Obviously, you only normally get about 9 minutes max. But you will get a lot of useful prep with how to do psych histories. Just keep in mind they're much, much longer. When it comes to management, the key phrase here is biopsychosocial model. In your head, you want to think, okay, biologically, what are the actual symptoms of this disease? Psychologically, how does it impact on the person from an emotional perspective? And socially, how does it impact kind of on their job, on their family, etc. As for the other firms, most of them, like we said, are relevant to 6th year. Here are some, however, that will be relevant to, so specialties, I think GP is a good one. On your GP placement, say to the GP, I have exams on obs and gynae, peds, and psych. Can you please try and prioritize patients for me with some of these conditions? I did loads of peds during my GP, perhaps even more peds than when I was on peds itself. So use GP for specialties. Derm, loads of children get rashes, so there's a lot of overlap there. And then for the others, so as Laz mentioned, oncology, they will give you, let's say, ovarian cancer. Turns up in gynae, but it also turns up in histopath as well. But yeah, let doctors know what you're looking for. Also, the other firms are a good chance to get some of your DOPs done. A lot of the DOPs this year are quite random, so they don't need to be done on the big 3. Quick point about study leave. you might think, can I use it for a holiday? I'll be honest, you can. I'll show you my rotation a bit later. But my first kind of block of year 5, I had Path, Obs and Gynae, Derm, and GP. This was like almost 20 weeks non-stop. So when I got to my study leave, I was like burnt out. So I could not do any studying. I just took the week off. And I think on the whole, you'll find that most people, their first few study leaves, they might go on holiday, they might just stay at home, they might relax. And I think that's pretty understandable considering how long the year is. But once you get maybe towards the second half of the year, you'll find a lot of the time that's when people start to knuckle down and they use their second lot of study leave for actual study. So if you're wondering, you can use it to relax. Maybe Imperial wouldn't say that, but I think considering how much they give you to do, relax for the first few study leaves, study for the second 2. So Laz, I think I'm back over to you now.
Yep. Can you hear me?
Yeah.
Okay, sure. So I'm just going to move on to talk a little bit about the different resources that you can use. So first and foremost, there's a few textbooks which are sort of stereotyped as being the textbook for each specialty. And I've listed them on screen at the moment. So a lot of people will buy LaSalle's for Peds, 10 Teachers for Obs and Gynae, and PRN for Psych. And how you use the different textbooks. I mean, some people, like me, read each of the textbooks cover to cover, and that wasn't particularly beneficial, to be honest. So I only did that just because I felt a bit weird not actually making notes on something. And I thought that just going through the textbook and just essentially summarizing everything that I read would be useful. But in the end, I found that once I'd made the notes, I didn't actually go back on it very much. So I think the textbooks are probably better as a point of reference as opposed to something that you literally just read from front to back. And the other thing about textbooks is that it's not very good at emphasizing which topics are particularly important. So for example, in the Peds textbook, you might have as much information on like metabolic diseases, lysosomal storage diseases, as you do on something like croup or bronchiolitis, which is a big topic. So I'd use textbooks more as a reference. So for example, if one day you decide you want to learn a bit about Peds RESP, then you can have a flick through the textbook and just get sort of your bearings in terms of what each of the diseases is. But yeah, those textbooks are good and they're quite useful. But I don't think reading them front to back is really the best use of your time. Questions are a very, very good way of learning as well. And even when you guys were in third year, I recommended starting questions early. And in terms of the resources that people tend to use, PassMed is by far the most common. And you would have heard a lot of people talking about it. And I've got sort of mixed feelings about PassMed. So it is good because it has quite a lot of questions. And I'd say the best thing about PassMed is that the summaries that you get are quite succinct, and also it has the most up-to-date, nice guidelines in them. So the explanations and the summaries are very useful, but I'd say the question quality is sort of lacking. And PassMed also does this weird thing where they have these certain topics which they have hundreds of questions on, and there'll be other topics which are equally important, which won't really be covered at all. So so it is still worth getting for sure. It's like £20 a year for a subscription. And when I was going into firms, so I had Peds in like October or something, I did some of the Peds questions before I started Peds. And I know a lot of people tend to be quite averse to doing that just because they think to themselves, I don't know anything, what's the point in doing the questions? But I still would recommend doing it just because you learn a lot from SBAs, because SBAs sort of keep you on your toes. It's not just a case of just reading a block of text like you would in a textbook. It actually gets you thinking. And by actually interacting with the questions and submitting an answer, you engage with the content a lot more than you would with a textbook. So I'd recommend that to anyone who's got whatever first placement they've got coming up. Maybe just do some of the questions from PassMed and you'll learn some of the main topics, and you'll learn them. You'll see the summaries and you'll have a decent idea of what's going on. So I'd, generally speaking, recommend starting them earlier than you think you should. PassTest is another resource which I'd say a minority of people used, and I only used that in like the last week or two before exams, just because no one really seemed to be talking about it. So PassTest, they do have books out, but I'm recommending mainly the website. So it has a load of questions on Obs and Gynae, Peds and Psych, And I'd say the question quality is much more similar to what you get in the exam. So it's better from that point of view. The explanations are also very thorough. It doesn't tend to have the same sort of simple summaries that Pass Med does, but I think the questions are definitely worth doing. And it's probably harder than Pass Med as well in terms of the types of questions that you get. So I would recommend using that as well. And it also just increases the bank of questions that you can use. In addition, some of you may have used the Get Ahead books in third year. They have a similar version, the Specialties version for fifth year, and they're really good. So the questions are well written and the explanations are generally pretty good. The only fallback is that I think they were published in like 2011 or something. So some of the guidelines may be a little bit out of date. And as I'm sure you're aware, a lot of the exam questions in the Specialties written exam especially are very focused on management. And I think Carolina said shout out to RevMed. Yeah, so my book's also available. There should be quite a few copies in the library as well in case you wanted to have a look at those. And I based it as much as I could on the exam that we had. So basically just do as many questions as you can and try and start them relatively early as well. Don't be scared by the fact that you perhaps don't know anything, because it's not the point of the questions isn't just to get them all right. It's actually to, in a way, get them wrong and learn from the actual explanations. Do you want to move on to the next slide? Okay, so with this, I was essentially just trying to give some very targeted advice, because we're giving you a lot of information right now and it can be a bit sort of disorientating, but I just want you to think about which of these placements you have first, so coming up in the next few months. So like I mentioned, management is a huge part of it. So you need to make sure you know the guidelines fairly well. And I've written down the kind of sources for these guidelines. So Psych and Peds, it's NICE. Obs and Gynae is the Royal College of Obstetrics and Gynecology, or RCOG, and GP is NICE CKS. And these sources can be a little bit cumbersome to sift through and actually extract the information you need. So, so when I was in fifth year, I made like management guides, which essentially meant that I went through all the NICE guidelines and tried to take out the important bits and make it into summary. And since then, MedEd has actually kind of glammed it up a bit and made it into a Specialties guide. So I definitely recommend using that, just because in the last maybe 2 months before exams, I didn't really revise from anything else aside from just my management guide. And that was really useful, because in terms of any condition, the management is always the hardest part to learn, because you can, generally speaking, by the time you get to exams, you'll be fairly good at diagnosing things and identifying the constellation of symptoms that are basically linked to whatever bronchiolitis or croup. But remembering the specific management can be quite difficult. So I focused a lot of my attention on the management, and that was very useful for me. Then in terms of things to learn from firms, I've tried to make it about 1 or 2 bullet points, just because it is confusing having these placements and not really knowing what you're meant to be gaining from it. So I've tried to summarize it into just a couple of fairly achievable points. So I think Dan also already mentioned this, but with psych, a very important thing you need to know is which services are available, because psych tends to be managed in the community and in hospitals, and there's loads and loads of different services for the different types of conditions. So there's like an eating disorder service, there's a home treatment team, a crisis resolution team, all kinds of stuff like that. So you need to basically ask your consultants, ask whatever psych regis are around about the places that you refer patients to and where they are treated, especially if it's in the community, because the services are fairly specific, like drugs and alcohol services and things as well. So make sure you have those questions at the back of your mind when you start your psych placement, and try and get those questions answered as much as possible by the doctors, because it's something that you can't really find anywhere online or in textbooks. And secondly, Dan already mentioned this, pharmacology is a huge aspect of psych. So you will sort of learn what classes of drugs they are and the side effects, etc., from reading about it and textbooks. But when you're on the placements, you'll probably notice that they very much tailor the drugs that they use based on the side effect profiles and other comorbidities. So that's something that, again, is difficult to glean from books. So make sure you ask your psych consultants, why are you using, I don't know, metazapine rather than sertraline in this patient with depression? And you'll get a better understanding of what the sort of general profile of each drug is and in which situations you'd use them. And in the Specialties exam, you do get a lot of questions like that, where they expect you to know sort of subtle benefits in one drug over the other, even if they're in the same class. with peds, Dan already mentioned the EpiPen story. That's it's like, make sure you get used to the various bits and pieces, practical things that you might need to do with the child. And then again, Dan mentioned this, but thresholds for hospital admission are very, very important. So I remember in our specialties exam, we had a few questions which sounded fairly similar, but the only difference was that they had subtle changes in their vital signs, or something critical in their history, which meant that we should worry about it. So it's a hard thing to really gain an understanding of, but I think going to A&E and seeing quite a lot of relatively unwell patients can be quite useful, just to have a clinical gauge as to when you would actually start panicking. Then moving to OBS and gynae. So with OBS, a lot of it's to do with just, again, clinical judgment of when something's going really badly wrong, because it isn't quite as clear cut as you'd think. And another big topic is practical measures. So the induction of labor is a very good example, because you can't really seem to find it in any books how you should actually go about it, inducing labor. But learning that from your, I don't know, OBS and gynae teaching fellow is really, really good. And finally, with gynae, screening programs, know them inside out, just because that comes up all the time. So cervical cancer, ovarian cancer as well. And finally, patient-centered management is probably one of the more important bits for gynae, because gynae is, again, quite confusing. So when you read, if any of you guys go through the management guides, you'll see that for gynae, it's probably the most complicated management sort of algorithm, just because with gynae, you need to take into account so many patient-based factors. So like their age, whether they want to have kids, what type of contraception they'd be happy to have. And you need to develop an awareness of which factors really do affect a patient's decisions. So by sitting in gynae clinics, and sort of contraception related things can help you understand how to tailor your approach to the patient. So I remember in PACES in my year, we had a patient with polycystic ovarian syndrome who was struggling to get pregnant. And the way that you manage that is dependent entirely on the patient's needs. So the fact that they were trying to get pregnant means that you're not going to give them some sort of contraceptive to reduce their heavy menstrual bleeding and all that kind of stuff. So make sure you try and stay tuned to the patient factors that drive management. And finally, with GP, again, a bit like psych, it's all about the resources available. So I found GP probably the hardest section of the specialties exam, just because the questions were much more about the practicalities of it. So for example, you might have a patient with a PV bleed, and they'll ask you what you do to what you do next. And essentially you need to know that transvaginal ultrasounds aren't something that can really be done at most GP practices. So you need to understand what the limits of a GP practice is, and where patients should be referred thereafter. So that's my main tips for that. Dan, do you want to go on next slide? Is it still me? Okay, let me just quickly answer a couple of the questions. I have no idea if anyone has PDF versions of Get Ahead. What do you mean by early? We start placement on 27th July to start straight away and focus on the rotation we are on. Yeah, so that's how I would do it. I mean, people have different ways of going about it, but hypothetically, if I was starting on peds, OBS and gynae, let's say I was starting on OBS and gynae, I'd probably, in the week before, I'd just click on, so on PassMed, you know how you can select which types of questions you do. I'd probably just click the OBS and gynae sections and just do a few questions. Even if I know nothing about it, I'd just do it, just because it gives you an idea of what kind of presentations patients come in with, and it gives you some bearings. Because if you just start reading a textbook, you're not going to know how to actually focus your attention. Whereas by doing questions and seeing what comes up, you can see what's generally examinable topics and common and important topics. So it doesn't matter if you get the worst PassMed percentage in history. That's not really the point, especially because you're going to reset it later. So it's literally just a matter of just getting some exposure and understanding. And I think that would massively benefit you. Did you use Sophia to make sure you covered everything for specialties? I'm personally really not a fan of Sophia, just because I think it's a fairly arbitrary way of mapping a course. And they literally just put a bunch of learning objectives on there about epidemiology and signs and symptoms. And I don't think that really helps guide revision work very well. So I basically didn't look at Sophia at all the entire year, because I don't even find that, I find that Sophia is such a vague net that any question they give you in the exam can somehow be linked to Sophia. So I don't think it's really a particularly useful way of structuring your revision. But some people like it because it gives you a fairly rigid structure on how to make notes. But I'm personally not the biggest fan of it. Any other questions or specialties written exam? How do you recommend we actually learn the core content? Because questions alone can't do it. To be honest, I'd argue that you can do it with questions, because especially on PathMed, they have summaries of each of the conditions. So let's say you do a question on ectopic pregnancy, then after you do it, get it wrong, whatever, it doesn't really matter. You see a big summary underneath, which essentially tells you everything you need to know about ectopic pregnancies. So you can potentially make notes on that. You can use the PathMed summaries and essentially transfer that into your own notes. And that can be a good way of sort of making sure you see all the content in one place if you want to. But yeah, I found that questions literally do cover everything. So after I'd finished PathMed and PathTest, I didn't feel like there was very much in the textbook that I didn't already know about. You do need to sort of commit to it, because dipping in and out of it is likely to miss fairly big topics. But questions are a good way of covering the core content, and that can be supplemented by using a textbook as well. Right, I'm going to move on to this next bit, which is about extras. So Dan mentioned that you have a lot of free time in fifth year, contrary to popular opinion. You'll have a few sort of weeks, you'll have some placements which are not particularly intense. And you can use this time to actually benefit yourself in terms of the future. So I want to just put a disclaimer out there that this is not something that's by any means essential. It's just something to consider if you have time on your hands. So letters to editor, I think you guys are fairly well versed about it already, and I know some of you had a letter to editor as a thingy as a ICA last year. But essentially, if you have a few weeks off, it might be worth just having a look at PubMed to see if there's any recent publications about I don't know, medical students and medical education, and then putting together like just sparing 2 hours to write 500 words of waffle about something to do with MedEd, and then trying to get it published, just because it doesn't take a huge amount of your time. And fair enough, I know it's not particularly nice to have letters rejected, but it only takes one to actually improve your FPAS score. And I've listed a couple of the good journals at the bottom as well. But make sure when you try and write a letter to editor, make sure you check that the publishers and the journal accept letters, and make sure you are basically filling the criteria for a letter to editor before starting it, because or else that could be a huge waste of time. And should move on one more down. Okay, so SCP, it very much depends on what type of SCP you chose. I chose to do the MedEd one at Hammersmith Hospital, and that was without doubt probably the most chill 4 weeks of my life. And essentially, I just used that to do a project with my supervisor. I didn't really have to go in very much, and it was quite good. Like, I managed to get a publication out of it. So I'd recommend using that time, because it's a fairly lengthy chunk to do something, I don't know, like an audit or a CQIP, just to fill that time and make it worthwhile. But if you want to just take it off, fair enough, I'm happy to do so. And next, done. Oh yeah, and one last thing. This is not really for everyone, but if you have any vague interest in teaching, I'd massively recommend you guys getting involved with that. So whether that's through your clubs and societies or through MedEd, just make sure you do it, because strangely, I did find that it helped me a lot with PACES, because when you're teaching, you have to take in information, so a question that someone might ask, and you've got to process your thoughts and communicate it in a coherent way. And that's exactly what you do in PACES as well. So essentially, you're honing a skill that will be useful to you in PACES, and also is useful to you later on. So when you start going for interviews, if any of you want to do AFP, I found that doing lots of teaching was invaluable to me, just because it did make me quite good at.
We're in a lecture live.
Someone's thing's still on. Right, okay, if we move on, Dan.
I think I'm doing the next half anyway.
Okay, shall I just quickly answer a couple of the questions? There's one more question. Did you make detailed notes of PathMed and PathTest? So I didn't really make detailed notes of them. On my OneNote, I added like a tab where if there's any topics that came up in PathMed which I wasn't particularly solid on, I just copied that across. And also I use Brainscape in that scenario. So for example, if I say one day I did like 100 PathMed questions, and there were a couple of things I got wrong or a few facts that I didn't really know, I'd basically just turn that fact into a question of its own and put it on Brainscape. Because Brainscape was essentially like this, almost like a dustbin of things that I don't really know very well, that I just kept on adding to. And it meant that I was essentially just creating a bank of my weak points, which I can go over regularly and reinforce. And that's why Brainscape is so good, because it helps basically fill up the gaps in your knowledge. Using this, how do you structure? Yeah, that's fair enough. So, like I said, my notes, I didn't actually really use a huge amount. So it's useful. So I read all the textbooks front to back and made notes on it as I went along. It was fairly painstaking and exceptionally boring, but I didn't actually use the notes very much afterwards. So from your point of view, I'd probably recommend using, well, maybe using the questions to identify the main topics that come up. So like ectopic pregnancies in gynae, or like premature labor in obstetrics, and essentially potentially using textbooks to learn about those main topics. So rather than going through them front to back and picking up all the kind of archaic, like small topics, just focus on the big ones by getting an understanding of which topics are important from doing questions, and then maybe use a textbook to supplement your understanding of those topics. How do you know how much to know about each specialty? Is it possible to go into too much into detail? I mean, that's a pretty difficult question to answer because it's always possible to go into too much detail about anything. So it's just a matter of, and again, questions help with that because it helps you understand roughly what level you should be learning to as someone who's sitting medical school 5th year exams. So yeah, so I mean, I think again, questions help with that, and textbooks, generally speaking, don't go into huge amounts of technical detail. They tend to contain summaries more so. So I wouldn't worry too much about going into too much detail because I think most people realize when they're digging a bit too deep. So there's no real, I don't know, sort of clear scientific way of telling you where to stop learning. And finally, it's worth starting PATH before January. It's better to focus on specialties until then. I'd say, well, I made my notes before January, so just basically whilst I was doing the PATH course because there wasn't much else to do. And then I basically left it until January. So yeah, so I did just leave it until then and focus on specialties. How long did it take you to go through the 3 textbooks? I honestly can't remember at all, but it was long and it was very boring and I wouldn't really recommend it. Maybe scan through the contents page, and if you want to use a textbook and get a decent idea of the big topics, have a look at the contents page, speak to older years and maybe identify which topics are particularly important and then just make notes on those big topics, because the smaller stuff, you'll probably pick it up from SBAs anyway, rather than having to read through like a whole double page spread on, yeah, like I said, lysosomal storage diseases or whatnot. List of conditions to learn. I imagine Sophia technically has one, but like I said, Sophia is not the be all and end all. So I didn't really use a list. Okay.
Right, shall I keep going?
Yeah, keep going. I'll have any other questions at the end.
So on that topic of Sophia, I'd agree with Laz that especially for 5th year, Sophia is a bit silly. So if you go in PEDS, one of the topics in PEDS is viral illness in children, which is like an endless list of viruses. So if you go through Sophia, it's hard to get a sense of what is important, what is quite niche, and kind of like Laz said, it's like 3rd year. When you start off, you don't know how much depth to go into, but over the course of the year, both from kind of firms and from SBAs, you do start to build up like an inner sense of, oh, that's quite important, or that's really niche and specific. I don't need to know that. Sounds a bit hard to believe, but over the next few months, especially when you're on firms, you'll start to see what is and is not important. Someone asked earlier, I didn't answer, how do you study whilst on O&G? I would suggest when you're on your obs and gynae placement, try and do lots of histories, because an obs and gynae history is different to a normal history. And obviously once you finish that placement, you won't get as much chance to go back and do those histories again. So I think that would be my key tip. So Laz told you a little about some extras for 5th year. I'll quickly speed through some others. Most of you have just finished your BSc and you've done a project. Try to milk that project for everything you can get from it. So it's quite easy to get a poster presentation from most projects, whether the project was good or not. All you really need to do is identify a suitable conference and then submit your work as an abstract. So for example, my flatmate did medical humanities and he thought there's no way I can submit mine. I think he did his on how death is portrayed in Disney films. And you'd think there's no way you could submit that, but he found a conference on childhood grief submitted to this conference and you got a poster. So most BSc projects, if you find the right conference, you can get a poster, possibly a presentation. And then yes, if you chat to your supervisor, I would have a meeting with my supervisor if I were you, and I'd say, what do I need to do to get a publication out of my project? You might have to do a little bit of extra work. They might want you to do a few extra steps, but it's always worth a shot. And remember, you normally get 3 days of study leave each year to attend conferences, whether or not you're presenting at that conference. And they do have a fund to help you go to conferences if you are presenting or you've got a poster. Does a poster at a conference count towards FPAS? No. The only thing for FPAS are publications. But do, yes, try and get one from your BSc project. Why I mention presentations and etc. When it comes to specialty applications after like F2 and so on, having posters and things are quite helpful at that stage, or if you want to apply for the AFP. I don't believe either of us did step 1, the USMLE. I'll chat about that a bit later. Also, I found in 5th year, there were loads of chances to get involved in research. Most placements I was on, I could probably have approached a doctor and said, I want to do a bit of research, and can you please help me out? And there are a lot of people who got things published based off small little projects they did whilst on firms. Like Laz said, SCP is often a good place to do that. If you did a lit review, can you submit it for a poster? Yes, you can. It's just like any other bit of research, you can submit it for a poster or a publication. Does teaching help for any kind of applications? When you get to your specialty applications, you do need to show evidence of regular teaching. So not for FPAS, not for AFP, but yeah, when you get to specialty, you do need to show that you've been doing teaching. Better to start now rather than later. Electives, I normally would suggest get it done in year 5. I didn't, and it made it more stressful because I had to sort mine in year 6. Obviously my elective got cancelled anyway, so it didn't really matter in the end. I know that for yourselves, I think the Medical Schools Council have given some updated guidance on electives for next year. Maybe have a look over that, because there might still be some countries that you can't do your electives in. I know it's a bit stressful. And then finally, do spend a day or two just like collating things you've done over the last few years. Why I say this, your Imperial email only goes back a couple of years. So if you kind of helped out at mock OSCEs, or you did some teaching or a bit of research or a conference, any certificates that were sent in an email will be gone after about 3 years. And I only realized that probably midway through 5th year, and perhaps I lost 1 or 2 certificates that I could have had if I'd gone through and downloaded them. So make a folder on your computer if you haven't already, put everything in one folder, and then you can start using that to figure out kind of where are the gaps in your portfolio. Do you not have much research? Do you not have much teaching, etc.? I mean, there are even things from year 3 that you can work on. I got my CQIP, the quality improvement project in year 3. Mine was a terrible quality improvement project, but found a conference and got a poster out of it. Or someone else in my group did, but I got my name on, so it still counts. So you've just done your BSc, most of you. You've also done things in year 3, like your case reports as well. See what you can get out of this. Like I said, if you can't, don't worry. FPAS is just how you do in 5th year, your BSc, publications, and SJT. None of this would count towards FPAS, but if you can get it done now, it saves you extra work either next year or when you're a doctor. So just to wrap things up today, we'll quickly run through all of the support that MedEd offers for year 5, because there's quite a lot. When people were asking earlier about structuring their notes, on the note bank at SU, there are lots of 5th year notes as well. And I think a lot of them are kind of divided up per Sophia. So if you do prefer it that way, if you do prefer the structure of Sophia, there are some notes on Notebank that do it that way as well. So probably the thing that you've heard about most is the Path Guide. You can access the Path Guide from last year on the MedEd website for free. It's currently in the process of being updated so that it matches your curriculum this year. But the one from last year is 99% the same. There's going to be very little different about it. It's authored by the Path lecturers who all did very well in their Path exams. And you can always get it for free online. But yes, you can buy a hard copy of the Path Guide. Can't tell you what the price is now because it depends on how many people buy it, etc., and how much the printers charge. But what we do is print off kind of quite a nice, not exactly hard copy, but nice copy. It's about 200 pages, the Path Guide, and in that is everything that you need to know for the test. A lot of people use it to structure their Path revision. You can always get it for free online. The key thing is if you want a hard copy, there will be a deadline later in the year. MedEd will let you know. You must order by that deadline because they bulk buy the Path Guide. Just keep that in mind. Laz also mentioned the Specialties Management Guide. So that is new. It was only brought in last year. And it's based off a lot of Laz's notes, focused on the management for year 5. Because this is the sort of stuff where you waste a lot of time looking up guidelines and trying to figure things out. And so it's really useful because it just saves you time having to trail through lots of web pages. Quick question about regarding posters. A lot of conferences seem to be cancelled. There are lots of virtual conferences. So if I were you, look out for a virtual conference. You can get your poster and it's actually even easier as a result. So there's quite a few virtual conferences. I'd recommend start there. And then when conferences start back up, if you haven't got one, submit to an in-person conference. So the Path series that we run from January to March is designed to cover the core topics of Path. It is not designed to cover 100% of the exam, but those lectures cover the high yield topics. So when people earlier asked what turns up most frequently, the purpose of the Path lectures is to focus on them. 2 lectures per module, and again, all delivered by people who've done quite well in their Path exam. Around April, May, we then run a specialty series where we do a couple of lectures per specialty, normally by a doctor in that particular specialty, but we try to keep them SBA based to again keep it relevant to specialties. As Joanna's mentioned in the chat, you can look at all of the MedEd materials from last year. So you'll be able to find the Path Guide, you'll be able to find the Specialties Guide, you'll also be able to see all of the Path lectures and all of the Specialties lectures. You can get the slides for all of those from the MedEd website. You might have also realized that we've set up an Instagram page recently. I would recommend that you do follow that. Why? Well, we do include loads of quiz questions from year 5, both for Path and for Specialties. So do give the page a follow. Obviously, we're not going to be posting loads of questions right now because I think that just will annoy people. But we do have all of the questions saved. So if you do want to kind of go through and quiz yourself, there's lots of example questions on the MedEd Instagram account. So just to wrap up with a few general tips. You've probably heard this from people already. 5th year is a marathon, it's not a sprint. It is the longest year of med school, and it is very easy to tire yourself out if you push yourself too far. So you really need to have an idea of, okay, it is now week 2 of Path. Some of you will have study leave in 6 or 7 weeks. Some of you will have study leave in 15 weeks. Each person is a bit different. And therefore, 5th year, you can't really base yourself off what the others around you are doing because each rotation is quite different. But the key thing is, for now, just keep going. Use your study leaves to relax if you need to. Don't push yourself too far because a lot of the actual work will start off probably from around January onwards. So like I said on that topic, everyone is a bit different. Here are your different groups this year. So I myself was in group 5. Sorry, not group 5, group A. I was in group A, and like I said, it was really difficult for me because I did Path, O&G, and then dermatology and GP. So I did 17 weeks straight. That's the longest stretch I've ever done of med school. So when I got to that study leave, I did not have any energy to study. So if you're in group A, you probably will feel quite similar when you get to the end of October. Whereas a lot of you will have study leave after your first placement. But every block has its pros and cons. So if you look at my block, block A, I actually had study leave right at the end before exams, whereas other people were still in placement. So each rotation has its pros and cons. I think have a look at yours and try and get a rough game plan of when you do ideally want to start revision. But importantly, don't look at friends who are in other groups, B, D, E, etc. Don't look at what they're doing and base yourself off of them. Because you'll find that most people in 5th year have some sort of mini breakdown at some point. I don't mean that to say, oh, this year is terrible. I thought 5th year was actually quite fun. But everyone has a point at which they get quite overwhelmed. And it might either be you're the first one where this happens and none of your friends understand, or one of your friends is overwhelmed and you think, well, why are you getting like this? 5th year is easy. I promise you, at one point, eventually you will be that friend. Everyone has some sort of mini freak out at some point in 5th year. Yours might be before everyone else's, it might be after everyone else's. So if someone else is freaking out, obviously be nice to them. If you're freaking out and everyone else seems fine, remember everyone is a bit different this year. And someone mentioned there step 1, if people wonder what that means. So 5th year is long, but as a result, you can get quite a lot done in 5th year. We've mentioned a lot you can do with your portfolio. So Laz and I, for example, we were MedEd co-chairs that year, which was quite a big role, but we managed to balance it. I know people who did the USMLE, the exam for America, during 5th year. I know people who set up a business in 5th year. Now, I'm not saying you need to do any of those things. You do you, basically. If you want to have an easygoing year, if you just want to focus on your studies, no problem. The key thing is you obviously can't do everything. You can't do the USMLE and set up a business and be the co-chair of a society. You can maybe do one of those things. So again, try not to stretch yourself too far. Question here, I'll come back to that one at the end. But a few of the general tips. People asking about PDFs. If you ask around, there will be free copies of most PDFs, or if not, you can generally find them if you look in the right place online. Download them to your iPad. So if you're ever in a clinic, you're a bit bored, you can, or you're sat outside waiting for someone, you can just scroll through it. You can get PassMed on your iPad, on your phone as well. I'd often do a bit of PassMed like on the bus to a firm or on the way back. Like we discussed, have a game plan by the middle of the year. So once you get to after Christmas, start to kind of map out your plan for exams. Are you going to start mainly with Path? Are you going to start mainly with Specialties? Everyone is a bit different. As we said, everyone's 5th year is a bit different. Use this to your advantage. So my psych placement was my final placement. Some people did that in term 1. So friends who were on psych, I often ask, what was their advice from psych? What stuff do I need to know about? So that I could get a lot of that knowledge without waiting until the end of the year. So do make use of one another. If one of your friends has done a firm you haven't, get some advice from them. And we did say this year, doctors generally are quite helpful. Do mention to doctors what you want to see. So if you're going into peds and you really want to see, what's a good example? Let's say Hirschsprungs. I think it's quite rare though. They might be able to say, okay, here's a patient with Hirschsprungs, they're on this ward. They probably won't, it's quite a rare disease. But you get the idea. Say to them, I want to see X condition. Do you know where I could find a patient with that particular condition? Or I want to practice doing some gynae histories. For the clinic today, would you mind if I do 1 or 2 histories and you observe? Always worth a shot. And then finally, like we said, it is a busy year. It is tiring. Do pace yourself. Be kind to yourself as well. Don't feel guilty that you're using your study leave to sleep, because often that's probably the best thing for you at that time. So I think we've reached the end of this. Let's just take some questions.
Before you do, Dan and Laz, first of all, thank you so much for the talk. We'll go into the Q&A, but for those who want to leave, I just want to mention a few things based on some of the questions that were raised. Firstly, very quickly, do the feedback on the page. Secondly, the issue with current final years not having their PACEs was addressed, and we just want to say that MedEd is working on creating some mutual learning groups, because final years currently have done some specialties. They didn't have PACEs, but as Dan mentioned, they will be preparing, or Laz, sorry, one of you, they will be preparing for those. So the mutual learning groups will be, will sort of try to make everyone sort of practice together and revise together. So this is currently underway, and we're just trying to sort of figure out how exactly we're going to be orchestrating that. And secondly, someone asked, how can we find cases? And yes, I think it was really good advice that we can make our own, but I just wanted to also mention that Jay and I are trying to make a folder with resources like cases from older students, and we will publish that as in send it to you as soon as we have it sort of organized and nicely done into the different specialties. Yeah, that's it. We can go into the Q&A. Thank you guys so much for the talk.
Thanks for that. So you've got the QR code there. Someone might want to put the link in the chat as well. Yeah, please do the feedback. We really appreciate it. So question on, where do you suggest starting revision, like directly into questions? How do we know we've covered exam content and PACES content? Where do we refer back to make sure we've actually covered the main things? I think that's, like I said, compare PATH and specialties. The nice thing about PATH is you know when you've done what you need to do, because it's all nicely contained in a lecture series, in the PATH series. Everything else, it's like third year. You don't really properly know when you have done what you need to do. Obviously, these topics you could go up to consultant level. The main way to look at this is you're looking at it as in the perspective of what would be expected of an F1. What would a safe foundation year one doctor know about these topics? That's the way that they frame it to you. I would, like I said, like Laz said, I think starting with SBAs sounds counterintuitive, but especially like PassMed. With PassMed, they have really good answer explanations, and the answer explanations are basically notes in themselves. So often those kind of resources are a really good place to start. PassMed only looks at certain parts of the specialties. And as a result, you can obviously use Sophia. I wouldn't get hung up on making notes on Sophia, but I think a good place to start if you want just the core bare bones stuff might be the notes on the note bank. That's where I started. I looked at the notes on the note bank. They're called high yield notes because they're literally like one single sentence about different things. How our experience of firms differ with COVID, to be honest, I can't tell you too much about that. I don't think there'll be any higher expectation of you. I do think, yes, that often at times attention will be diverted. I mean, you could argue it a different way. Doctors have not had students on the wards for ages, so they're actually probably quite nice to have them back. They probably haven't done any teaching in a while. Secondly, staffing in hospitals is actually a lot better than it was this time last year. So in some ways, there are certain wards where doctors have more time for you. So I think it will differ from one firm to the next. Does anyone know the password, the new password for Notebank?
Phoenix 1997.
The specialty paper bigger, harder than the pathology paper. There is more covered in the specialty paper, but I believe the exams are the same length.
Yeah, from what I've heard about the year below, it seems like the specialty paper was considerably harder. But that's also caveated by the fact that they could Google stuff because it's an open book exam, and I'd say PATH is more Googleable than specialties in general. So I wouldn't say that one's harder than the other. I think sort of average marks for both of them were relatively the same in our year. So you should roughly evenly split your time between the two. And yeah, like what Dan said about the COVID era hospitals, everything is starting to wind down at the moment, so people will be quite happy to see you there, to be honest. And if anyone's at Ealing, let me know because I'll be there. And I literally can't wait to sign off an iPad, be on the other end of it. How to unlock the Brainscape? What happens when people try to go on the Brainscape cards? Is it saying it's locked? Anyone?
Yeah, it seems to be locked for the majority of people.
Okay, that's weird. Okay, well, I'll check that out because it should be free for everyone, but Brainscape's a bit weird. So some people, I think someone mentioned earlier that they were able to download the cards. So it can be a bit strange like that, but I'll, if there's an option to like request notes or something from the registered user, then just do that, and I can probably do something from my account. Any other questions?
So I think that's everything we wanted to say, guys. So if you filled in the feedback, do obviously feel free to head. We're not going to keep you here. But if people have got questions, we're happy to answer, of course.
And keep filling in the feedback, guys. Please. Thank you.
Because it seems a few people have had issues with the Brainscape app, that you might be able to look at them all on your laptop, not necessarily the app.
That's a very abstract question.
Oh, that's a loaded question. Wow.
What do you want as a percentage or a proportion? I honestly don't know how to answer that, Dan.
Oh, because it also depends of what you're looking for. If you're looking to like just pass, I might put like peds and path on the same level, roughly. I would say that psych is like a third of path, maybe, or maybe even a quarter. Psych's quite small.
Yeah.
Peds and O&G are both quite big. Peds is probably the biggest, I think. So you might look at specialties. I think probably in total, specialties is like double path, but these are very, very rough estimates.
Yeah. And also path is, I suppose, easier to get on with revising just because your content is there. Like it's there in a box and you just need to go through it. Whereas the specialties, you need to, there's different sources and it's harder to actually pin down exactly how you should go about revising it. I could answer this because I'm not the best at going into firms. And to be honest, when you're a fifth year, people treat you very differently to third years because when you're a third year, they sort of assume you're completely clueless, which most people are as third years. And also in third year, you don't really know how to miss firms and how to miss it in a sort of tactful way. So in fifth year, they're genuinely, it varies obviously, but most of the time they're fairly happy for you to just go off whenever you want to. And I don't think that'll be a problem that you guys will have to face. Yeah, I do have notes for specialties. It's on my OneNote. SSRIs for fifth year.
On the topic of kind of ditching close to exams, I think generally so not so much ditch, but I found across most firms, a lot of doctors were happy for you to not be turning up every day, as long as you were honest with them. And kind of, if I were you, I would, on my last firm, let them know early and keep reminding them, this is my last firm. I have my exams after this. Just really drill it into them. And then often you find they'll be a bit nicer. How important is it to go to firms? I think it does depend on the firm. Obviously, you want to prioritize the big three. And certain hospitals, like say Westmid, are notorious for they want you in quite a lot. Others are more relaxed. Again, like third year, you want to make sure if you're going in, you're getting something out of it. Things like O&G, I probably went in most days for O&G. I'd say if you're getting most of what you need, if you feel, oh, I'm going in, I'm practicing some histories, and I'm kind of like getting, every day I go in and I'm learning a little bit less than I did the day before, you're probably going in too much. For stuff like SCP, generally they don't really care if you go in for SCP. That's my perspective. For all the others, again, it's really hospital dependent. But I know some of the infectious diseases placements where people have to go in every day. Mine was 2 days a week. So I think it's really dependent. How much surgery theatre is there throughout the year? The only time you really will get surgery time is gynae. That's it. I probably spent like 3 days in surgery all year.
Yeah, and with firms, I'd say make sure you prioritize the time that you get with your teaching fellows. So especially for obs and gynae, peds and psych, you'll have some time with a consultant or teaching fellow, and that's when you can ask them all these specific questions about, like, I don't know, referral pathways and stuff that you just can't get from textbooks. So if there are times when you have like small group time with a teaching fellow, then make the most of that, because there's a lot of that kind of knowledge that you need to get out of firms, and it's quite efficiently done if you're with a teaching fellow as opposed to just mindlessly going around through firms.
On that topic, a lot of hospitals have a dedicated obs and gynae teaching fellow, and they are like the most helpful person in the world. Definitely use them.
Yeah, with the SBA sources question, so this is, again, the paradigm shift that I'm encouraging for all of you guys. Like, I think when you do GCSEs and A-levels, everyone has this intrinsic desire to save some past papers right till the end because like exam technique is such a big thing. But realistically, that's only beneficial for stuff where you have to work things out step by step, like a maths exam, whereas medicine is finite. Like there's only a certain number of questions they can ever possibly ask you. So my argument is, with regards to starting SBAs early and doing them twice, doing them 3 times if you want, the reason you should do that is because the more SBAs you've seen, the more likely that the things that come up in your exam are things that you've already sort of seen before. So I always advise exposing yourself to as many SBAs as possible, just because exam technique isn't really a thing in medical exams. So knowing the SBAs inside out and knowing the patterns and the way that questions are described is really, really useful.
And I mean, also 5th year is so long that if you do SBAs at the start, you will forget them by the time it comes to like 3 or 4 months later. So like Laz said, drilling it into you, doing each SBA like 3 times across the year is a lot better than just cramming them all in at the end. Any benefit from path resources outside of lectures, included derived notes, path guides. So the problem with the path lecture content is, so it's hard to tell which of the lectures are very examinable and which ones are not. As mentioned, obviously the course leads are the ones to prioritize. The purpose behind the path guide is it's trying to identify the key topics you need to know, when a lot of the slides themselves will have superfluous information that you don't need.
So my specialty notes are only on OneNote. It's not on Word or PDF, just because I didn't really have very much time between 5th and final year, and that's quite a lot of those notes. But Path is definitely in Word and PDF, and I think there's a Google Drive folder that I made. Any other questions? I'd say no. I never bothered learning any of those.
Yeah, you don't study trials. Do you mean like cohort and like double blind and things like that?
I can't remember that coming up in Path.
So the only time you get questions on kind of what type of study design is this, is in final year, you get 1 or 2 public health questions in your finals exam. And it'll describe a study and it'll be like, what type of study is this? Oh, it's a cohort study. But never recall anything like that turning up in 5th year.
Yeah, I didn't.
Oh, Path Blackboard quizzes. They're interesting. So the Blackboard quizzes are from like 10 years ago, and it was stuff that Miran used to do with like some online forum for Imperial students. And they took the forum down, but he translated it all into a series of Blackboard quizzes. I think they are helpful to consolidate your knowledge. They're a good way to test you. But some of it is on really niche topics that maybe you don't need to look at. So I think you can certainly pass Path without doing the Blackboard quizzes. But I think you probably will do better in Path if you do those Blackboard quizzes.
The Path lectures are only good to identify the important topics, not so good for the actual content. Like, you need to learn all the details behind these topics. I'd say no to that, to be honest. I thought Path was fairly easy to revise in the sense that you just learn the lectures, just like 1st and 2nd year. That they may have some questions in the exam which are fairly specific and may just have been a small print point in the lectures, but generally speaking, there's no real reason to dig any deeper with Path than just going through the lectures and learning them in as much detail as possible. Any other questions?
No problem.
Right. Yeah, just give me 1 second. I'll try and find it.
histology slices and blood films, they're not the most high yield info. I would understand the core topics, and then once I'm happy with those, then I would do things like blood films and histology slides. I do remember a question in our path exam that was a histology slide, and the question was, what stain is this? And I think it was like a Ziel-Neeson stain. I had no clue. I was completely clueless. Often those questions of what does this blood film show? What does the histology slide show? They're the like kind of top level questions. They're not core content, I'd argue. So learn them, but only after you cover the core stuff first. So for PACER stations, heard from the two GP ones that ones are primary care. And then the other ones, one is primary care and one is secondary. Not necessarily. So for my peds ones, both were in A&E. For my psych one was A&E and one was CAMS, so child and adolescent mental health, which some people might argue is primary care. Some people might argue that because it is in the community. But the only ones that were in the GP setting were the GP stations. Obs and gynae, one was a gynae station in a secondary referral clinic, and the other one was obstetrics, and it was the obstetrics assessment unit for women coming in who are near to giving birth. So I don't think it is one primary, one secondary, because for all of mine, they were both secondary care. The only one in GP was GP. Last chance to ask any questions, guys. If not, do feel free to head. I don't really think there's any GP notes. It's a really weird thing that they've put GP in this. Why I think it is because Imperial historically have been criticized for not making many GPs. So over the last few years, they've really upped their aim to make more GPs or to prepare us better for general practice. And so although they say that they're assessing GP, they're not assessing anything new that they didn't assess before. So really, as long as you know your three specialties well, and if you go through them and at the back of your head think, when does this relate to primary care, you should be fine. I don't really think anyone has made specific GP notes because it's just the specialties recycled.
Exactly, and on that point, it's literally just looking at the management guide notes for some sort of condition and just knowing where sort of the GP threshold would be. So which bits would happen in primary care and which bits would be in secondary care. So there's no like specific place to revise the GP part of the three specialties. One resource I think is useful though is NICE-CKS, which I mentioned earlier, and that's essentially like on my GP placement I saw the GPs using it, and it just tells you exactly what you should do with certain presentations, and it stops at the limits of general practice. So it'll be like, if this doesn't work, refer to secondary care. So it's not comprehensive in terms of how to manage a condition fully, but it does tell you where the GP boundary is.
All right, if that's all the questions, thank you so much, guys. Yeah, thanks everyone for joining. Please fill out the feedback as well.
All right. See you later. Good luck for 5th year.
Thanks.
Bye, guys.